Is it going? Yes, it's going. Okay.
No.
Hello, my name's Mike. I'll be the nurse practitioner seeing you today. I think we met here a couple weeks ago. Let me wash my hands real quick.
Okay.
Ugh, are you here for a cough?
No.
No?
No. I'm just so dizzy. This makes me nauseous. Like I'm gonna throw up. And I've thrown up like 4 times already.
You're dizzy?
Yes.
Okay.
The room is spinning. And it won't stop no matter which way I lay or stand or anything. It's just horrible.
So, let's see if anything's changed from the last time I seen you.
Just
Go through this real quick.
okay.
43, date of birth, 6/14 and 74.
Yeah.
Okay, so let's talk about your dizziness.
Okay.
So it started this morning.
Yeah. I got up out of bed and it was just like the room wouldn't stop spinning.
The room's spinning a lot on you.
Yes.
It's not moving around. It's just spinning around like a top, like
Yeah, like I can't even see straight.
left to right, right to left.
I don't know. It just doesn't matter.
Okay. But can you see me okay? I mean, am I there? Am I
Well,
clear?
I know you're there.
Am I clear? Is it?
Oh, no.
Am I blurry?
No, you're not blurry.
I'm not blurry.
No.
Okay. So it started when you woke up this morning.
Yes.
And just in your head dizziness, right?
Yeah.
Okay. Which I don't know where else we could have dizziness from, but started this morning. Said the character makes the room spin when you move, when you get up, and when you move around. When you move around, like you turn your head from side to side, it's making it worse.
Yes, lots.
How about up to down? Does it really?
Yeah. Oh, yeah. It's like I can get in one. I have to like kind of wait in one position, and then finally it sort of is a little better, but then it just comes back again.
And it makes you nauseous. Otherwise, you're not sick to your stomach.
No,
It just when the room's spinning real bad, you get nauseous.
Oh yes. It just makes me want.
So you said moving makes it worse, getting up makes it worse.
Yes.
Nothing really helps it except for maybe staying still for a little while.
Right.
Okay.
I just want to go to
Of
sleep.
course, it doesn't move anywhere.
No.
It only happens when you're awake. I guess you wouldn't notice while you were asleep if you were dizzy. Severity makes you really nauseous. It's pretty bad. So can you walk? I mean, can you move around?
My son had to bring me
Your son
here.
had to walk you in here.
I
And
had to guide me because I couldn't walk straight.
you can't walk straight. So you're having a problem, like you feel like you're stumbling, or you're just having a problem navigating around?
Yeah, it just feels like I didn't have a V8. You know, like it just feels like I go sideways.
Okay.
Like I'm gonna fall over.
Like you didn't have a V8. All right. And any other illnesses going on? Any other things going on?
Well, a couple weeks
Lazy.
ago, I had some sinus.
Got a cold or
Cold,
something?
yeah, whatever.
Okay. You didn't come see me then, though.
No.
Okay. Had a cold a couple weeks ago, went away, and then this started this morning.
Yes. Yes.
All right.
Oh.
Any changes since I last seen you? The medical history, like any, you didn't get pregnant while I was gone.
No, because
That's
my
right.
uterus got taken out.
That's right.
God no.
Uterus taken out. Had the last eye exam January this year.
Yes.
Mammogram in March.
Yes. Yes.
Polyps removed back in 2008 during a colonoscopy. No new surgeries.
No. No.
No changes in your family. Family's still
Yeah. Everybody's
same.
still the same. Yeah.
okay. And
I'm sorry. I'm not trying to be. I just.
right.
So
Yeah, I'm sure you
horrible.
feel. Just trying to get everything straight. And
Right.
and you haven't changed any. You're still on the Singulair, the Omeprazole, the ProAir, the Zoloft, and the Concentra that I have you on.
Concerta. Yes.
Concerta.
Yes.
Yeah, Concerta that I have you on. No other new medicines.
No.
You haven't taken anything for this.
Well, I tried some stuff at the store. They call it for more motion sickness.
Mhm.
Dramamine.
Dramamine. Would you throw that up?
Yeah. Oh yeah.
Okay.
Totally.
And no new allergies. Allergic to Cipro, gives you hives.
Right.
Okay. You don't smoke.
No.
Still just a glass of wine a week.
Right.
maybe.
And I haven't even had any of that in like a couple weeks. So.
Still working as an OB nurse.
Yes, sir.
Still going to school.
Yes, sir.
Still you're divorced.
today.
Still single.
Yes.
Yeah. All right. No changes in your lifestyle. Still going to school. Staying at.
Yep.
Working all the time.
Yep.
Not moving.
No,
okay.
still fat. Still, yeah. You know, like.
Still have a dog, having trouble
Yep.
in there. Okay. Any chills or fevers?
No.
Body aches?
No.
Not like any eye pain or redness
No.
or no discharge? Any nasal congestion or cough right now?
No, sir.
No, you feel okay. You're breathing fine. Right? Any heart palpitations or chest pains?
No.
No. Do you have any stiff neck?
No, I don't think so.
Okay. In any diarrhea? You said you had some vomiting. You vomited times 4. What's coming up exactly? Like green bile or?
Well, if I try to eat anything, whatever I try to eat, or like, but I have to basically just sips of water because I'm so nauseous that my stomach, I just don't want to eat anything anymore.
This is water or whatever you eat. Okay. And otherwise, you're not nauseated. You just throw up.
It's just, yeah, it's just the spinning gets so horribly bad. I just,
Okay.
like right now, it's doing it again. Comes in like waves.
Well, I have your bag here if you need it.
Oh yeah, got it.
And we'll see if we can't get you something for nausea if this comes in. Maybe something for dizziness. But I do want to take a look at you first before we do that.
Okay, you can try. You can try. I don't know how well I'll do.
Okay. Let me get on some gloves here.
Okay.
Okay, I want to have you smell this for me. Tell me what you think it smells like. Keep your eyes closed.
Smells lemony.
I like lemons. Good. Smells like lemons. Olfactory 1. Good. I'm going to have you.
Is that supposed to help my dizziness? Cause it's not working.
No. It's not supposed to help your dizziness.
I just want it to stop.
Okay, I'm going to have you read this eye chart for me.
Oh, no. There's no way I can do anything like
It's
that.
just about an arm's length away. Can you read these letters here?
Everything's spinning too much. No.
Everything's spinning?
Yes.
That seems pretty clear. You told me, though, that nothing was blurry.
No, it's not blurry. It's just,
Okay.
it's just spinning too much.
So we'll defer the eye chart.
Anytime I try to focus on anything, I just get dizzy. Worse. Makes you want to feel like a
I'm going to look in your eye real quick here.
puke.
Look. I've got good reflex. Follow my finger. Oh, your eyes are jerking left and right there. Your eyes are moving like you have dizziness. We call that. Lateral nystagmus is what we call that. And that's usually a sign that you're really dizzy when that's happening.
Yeah, dizzy.
Moving this direction, and then this direction, this direction, this direction. Just watch them to you.
Ooh,
Okay,
no,
okay. Yeah, I don't want to mess with you.
No.
Let you any more on that.
No.
Okay.
Make it stop. Make it stop.
And you're blinking okay. I want to do and look in your ears as well, if I can.
Okay. Oh, let me get up.
Ears look good. And you're not having any ear pain?
No.
That looks good. I want to hear about 24. I want time for you to hear okay. Tell me when you start hearing the vibration. Okay, and then when you stop hearing it.
Ooh, feels like makes me more dizzy
Oh,
too.
okay. Here, we'll do it one more on this side. Tell me when you stop hearing the vibration. You don't hear it?
I mean, I can feel something. But I'm just so
Okay.
messed up.
You tell me when you quit hearing it?
No?
Okay. One more time. Tell me if you can hear it equal or one side or the other of both ears.
Ooh, that just. Okay, it's in the middle or something.
Okay. Okay. It makes it worse.
Yeah. Oh. Oh.
I'm gonna have you stand up. I want to see how you walk.
Oh, you're gonna have to hold on to me.
Okay.
I'm just gonna
Let's go like this.
over.
Oh, let's move this here so we can watch this.
There's the wall. Holding the wall up.
Okay, here we go.
All right.
Forward. All right. Let's go back to the bed. You're doing pretty bad there.
Oh.
Okay.
Oh. Feel like the puke again.
All right.
Oh.
Oh.
I don't think there's anything to puke in.
All right. So probably won't be able to do a Romberg test. I was going to have you stand up and close your eyes for me, but I'm sure I'm not going to be able to get through this test.
Oh, no.
Okay.
Fall over.
Tell me, just feel hot or cold?
Cold.
Okay. Hot or cold?
Cold. It feels good.
Hot or cold?
Ah, it feels good. Cold.
Okay. Hot or cold?
Yes.
That feels all right. Okay. Now you tell me, can you close your eyes? Can you feel me touch your cheek?
Mm-hmm.
Right or left side am I touching?
Left.
Okay. Sharp or dull?
Sure.
Okay, sharp or dull?
Dull, I guess.
Am I touching you with 1 or 2 points? 1 or 2? 1 or 2?
One.
Try this over here. Touching you with 1 or 2?
2.
Okay. 1 or 2?
1.
1 or 2?
2.
Same thing down here. Is it sharp or dull?
Sharp, I guess.
Okay, sharp or dull?
Sharp.
You lift your shoulders up for me. Okay. Can you turn your head to the side?
Oh.
No. Does it hurt or
No,
does it just makes you worse?
It just makes it spin worse.
It just makes it spin worse.
Whoa.
Grip my hands for me. This one. Here, do this one here. How do I lose that? Okay, that sounds good. All right. What happened to my hammer? My hammer is right over here. Okay, I'm going to check the reflexes out. That's good. Let that relax. That's good. That's good. Good. Relax. Okay. Oops. All right. Now I'm gonna look down this way so you can see me do your knees. Let your knees look here. Okay. Okay. And do your heel. Okay. Okay. And scrape the bottom of your foot. Okay. Again. Okay. Yes, you do want this dizziness to stop.
I'm not gonna die. Do I have a tumor?
I do not think you have a tumor. What I think you have is maybe labyrinthitis. You have pretty bad vertigo, and I guess I'm not supposed to tell you what I would start you on or any medicines like that. Okay.
Just give me some meclizine.
Yeah, some meclizine. Definitely. So my reviews from my review of systems. Let's see. She had denied fever, chills, body aches, no eye pain, no redness or discharge, nasal congestion, no cough. She does have dizziness with movement. She denies a stiff neck. This is hard to walk. No chest pains or palpitations. No cough, shortness of breath, or wheezing. Nausea, vomiting, diarrhea, and you listen to your lungs and your heart. Before I forget that. Just listen to your heart. Oops. Okay. And that over here. All right. Heart sounds good. Take a deep breath. Again. 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 Okay. And one more thing I wanted to feel for real quick. Since you did have a cold, I want to make sure your lymph nodes feel okay. Auricular. All right. And it looks like you have a little bug bite there on your neck. How long has that been there?
I don't know.
Like a mosquito bite.
Probably.
Okay.
Some Kansas birds.
Continuing on review systems, she denies any respiratory problems, no hemoptysis, no dyspnea. She has no nausea and does not feel nausea. She did vomit 4 times after she moves and experiences extreme dizziness, and no diarrhea, no abdominal pain or discomfort. She's normal VMs. Like I said, her lungs are clear. Her heart sounds are normal. On my review of her physical exam, the nurse took her vital signs prior to me coming in here. Her vital signs are normal. She was afebrile. Her heart rate was 88. Her blood pressure was 122/70, and her O2 set was 100%. General, she appeared to be in mild distress because of her dizziness, was unable to perform the Romberg's test, and some of my cranial nerve tests related to the severe dizziness. HENT, she has normal cephalic. Perla, her extraocular movements and muscles were intact. Terminates were normal and no redness, no abnormalities. Her ears and TMs are pearly gray bilaterally. Neck was supple, no posterior or no lymphadenopathy noted. She had a normal range of motion. On what range of motion I could do with her, no nuchal rigidity. Her lung sounds were clear, so oscillate. Cardiac S1, S2. No murmurs or rubs. No JVD, no cyanosis noted. No edema noted. She had good plus 2 over 4 pulses. Skin was warm and dry. I didn't notice we're not supposed to talk about the skin in this one. Okay, we're only supposed to do neuro. Sorry, I won't mention the skin. Neuro exam, cranial nerves were intact. I had cranial nerves 1 through 8 or 12 were intact, although I did have some difficulty performing some of the exams related to her dizziness. Her 3 reasonable differential diagnoses I figured would be labyrinthitis, vertigo. Labyrinthitis related to a vertigo. She could have had Meniere's disease, but I ruled this out because she has no tinnitus. She could have had some sort of brainstem lesion, which was ruled out from the normal exam, or normal cranial nerve exam, and some of her spinal cord exam. And this concludes my assessment for today. Thank you.